I'm Peter Block here at TCT in San Francisco, TCT 2015, and it's been busy. We're in San Francisco. China is a long way away, but there is an important Chinese trial called Absorb China, a biodegradable stent versus a standard stent. And with me is Runlin Gao from Beijing, China, who was the lead author of this trial. Dr. Gao, tell me about this trial. Tell me what the two groups were.
Yeah, the Absorb China trial is a prospective, active controlled, open label, multiple center trial. The patient designed randomized at 1-to-1 rate to absorb group and the sensory group. The primary endpoint of this trial is non-inferiority of the BVS compared with sensory in terms of in-segment lateral lumen loss at 1 year.
So this is not very different from the American Absorb trial in which it was a non-inferiority trial against a standard stent. Yeah. So tell me what you found between the two groups. It looked to me when I looked at the slides and heard the presentation that there was very little difference in the two groups.
Yeah, I think we found the non-inferiority was met. In the group of BVS, the mean of lateral loss in segment lateral loss 0.19, and in sensory group 0.13. So the difference is 0.06. The 95 upper confidential interval is 0.14, which is less than the pre-specified non-inferiority margin 0.15. So the primary endpoint was made.
So the primary endpoint, importantly, was made. I mean, no difference for non-inferiority. So let me ask you an important question. Since there seems to be no difference between a bioresorbable stent and a standard stent, what should clinicians take away from this? Are we going to use bioresorbable stents? And if so, why should we use them if there's no difference?
The BVS is designed to have a similar mechanical effect with a metallic stent at the fourth year. Then after the resorption of the scaffold, more beneficial effect can be appeared, like the vessel can restore its normal function, and there are no any harm effect for further revascularization. Also.
You're going to be doing long-term follow-ups from this trial, is that right?
Sure. Our trial will be followed up clinically 5 years.
Okay, so there you have it. No difference, and it meets the non-inferiority as far as bioresorbable stent is concerned. Long-term follow-ups are still pending. I think a lot will depend on the long-term follow-ups since there's no difference at 1 year, but at 1 year, very promising. Thank you very much.
Thank you.